Hi, everybody. Welcome to volume 2 of InnoNurse Recap, and today we're going to speak about telemedicine, new trends, and regulations. So, hi, Danielle. How are you today?
Hi, doing well. Thanks for having this conversation with me today. Appreciate it.
Perfect. So, first, my first question is, can you please define telemedicine? So, what is telemedicine?
Telemedicine is a recent form of healthcare where a clinician, a provider, communicates with the patient via video and text message, as well as a doctor or clinician, nurse practitioner can consult with a specialist.
What are some of the applications of telemedicine?
Right now, one of the applications, one of the tools that are being used is QuickBlocks. QuickBlocks is a tool where you can do video conferencing basically on an app. So the patient can use it, a clinician can use it, a specialist to communicate, as well as text messaging within the group. You can also, by doing this, it saves time on patient transport, it saves time on the provider transport, and it gives you a direct link connection to communicate, get questions answered. For example, if needed a dermatology consult, cough, cold, flu consult, as well as really good for patients with psychiatric diagnosis. They can talk directly with their psychologist or psychiatrist.
Can you name other companies that are at the forefront of telemedicine?
Another company that I find really interesting where they provide the doctors and the tools is Doctor Now, which is in the UK. Now, with Doctor Now, they provide something really special where you could call the clinician for cough, cold, flu, but they have something special where, as you're seeing the provider and they're diagnosing, they can also ship the medication to your location. So you don't have to go to a pharmacy. The medication's delivered directly to you.
Sounds good. Can you tell us about HIPAA and what are some of the implications of HIPAA um, in the telemedicine space?
HIPAA was a law that was put into legislation in the United States in 1996, and it's for patient privacy to protect a patient's identity, where it's a name, medical record number, and this information should only be shared with a clinician or with providers that have direct contact with the patient. And the way it applies with telemedicine is, say, for example, QuickBlocks, where someone says it's HIPAA compliant, basically it's encrypted. So none of the patient's text messages or none of the video conference can be accessed outside of the system.
So I think for a lot of folks, when you mention telemedicine, the first thing they have in mind, and it's kind of the stereotype of telemedicine, it's a good tool to reach remote communities. Do you think um, do you think nowadays this stereotype is changing and people see telemedicine as a more mainstream set of processes or tool?
I do. There's several ways that it can be used. For example, a mother that has three children and one child is sick and it's past the primary care time, urgent care is closed. It's a lot of work if they're alone to gather up all the children, take them to, after hours place or to an ER, exposing other children to, other diseases or sickness. When you could do telemedicine at home, the child could be checked, the mother can be reassured, the child could be diagnosed, all in the safety of the home without transport or inconvenience. Another way I've seen it used recently, referring to Dr. Now. A gentleman was ill, left his medication at home, got on a business flight and realized he left his medication. Was able to go on Wi-Fi on the plane, see a doctor, talk to the doctor, and have his medication delivered to the hotel. So for someone that's on the go, for someone that's, it can be inconvenient to leave home. Even a bedbound patient. When I was in Oslo recently, a bedbound patient uses telemedicine for hospital checks, for wound checks, has a wound nurse. So the wound nurse will consult with the primary care nurse at the hospital or at the rehab center. So for someone that's not as mobile, an elderly person, someone that's paralyzed, having access to your clinical team via telemedicine makes a big difference on cost and time for transport.
Okay. So besides HIPAA, what are some of the other regulatory challenges when it comes to telemedicine?
Regulatory challenges is the clinician or provider's license. Say you're a clinician in DC, can you practice in Maryland? So people have to obtain multiple license. And then within the state, they have laws existing for the use of telemedicine. So recently, Michigan put a law that clinicians can use telemedicine, but they cannot prescribe opioid products. The state of Texas has a law, you can do telemedicine, but the first visit, you must actually physically do a physical exam on the patient on the first visit. Then post visits, then it can be used telemedicine. So knowing the laws of the state and also the laws of your licensure, where you can practice, what you're allowed to do, is very important.
Do you think virtual reality, augmented reality, and mixed reality can be a game changer if implemented to telemedicine?
I think it's a very interesting question. It was something I would like to see. Will there be a blend of telemedicine and VR and AR together? I've seen VR and AR used for rehabilitation therapy, for PTSD. Now, if that could be integrated with telemedicine, that'd be something really interesting in the next coming years.
And last question. Do you think internet accessibility or the lack of it thereof is a roadblock to the adoption of telemedicine?
I think it's a roadblock. A lot of people are working on that across the globe to improve connectivity. For example, on the continent of Africa, cell phones are frequent use in the city as in rural communities. So areas that are really remote, that lack that hard connection or lack that continued Wi-Fi or cell phone service, it can be a challenge to receiving the care that they need due to lack of connection. So I think a lot of people are really working on improving the connection because that's the way things need to go to give everyone access to healthcare.
Perfect. Well, thanks for your time, Danielle, and see you guys soon.
See you next time. I think maybe in the next volume we'll discuss women in health apps or maybe imagery and social media. So we'll see what we'll come up with next time. So stay tuned. Thanks, everybody.